Hi, everyone. Welcome to our February installment of our MAS seminar series. We are so happy to have everyone attend and join us today. My name is Morgan. I am on our MAS team, as many of you know. And for the MAS seminar series, just want to remind everyone this is our opportunity to share what people in our MAS community have been doing. We are blessed today to have one of our MAS graduates and her colleague give a presentation and share about, what's going on in their world. So I will kick it over to them to allow them to introduce themselves and get their presentation started. Thank you again so much.
You're most welcome. You're most welcome. Thank you so much for having us. And today we are pleased to be presenting on bringing telehealth to rural communities through strategic partnerships. And my name is Halimah Ouedraogo. Let's see if, here we go. My name is Halimah Ouedraogo, and I am a proud graduate of the MAS program, class of 21. And I am the Chief Executive Officer of Taba International, which is a new startup that launched last year. And I am also a proud member of the Delta Omega Honorary Society. And during my MAS program, I specialized in global health planning and management, and also had a certificate in global health practice. And with that, I really was able to cultivate my passion for applied work and really moving the needle. And so that's the lens in which I'm coming to you today. And my co-presenter is Dr. Richards. And Dr. Richards, at this time, I'd like to invite you to introduce yourself.
Thank you very much. So good afternoon, everyone. I am Tess Richards. I'm the Interim Executive Director and Medical Director at St. Thomas East End Medical Center in St. Thomas, Virgin Islands. I am a family medicine physician by training. I've been here for 14 years at the center, but born and raised in St. Thomas. So this is my community, and serving my community is definitely my passion and my heart. So thank you for having us here to share our story, and thank you for the invitation. Okay, next slide, please. So for those of you who are unfamiliar with St. Thomas East End Medical Center, we are an FQHC or Federally Qualified Health Center. And our mission really is to serve the underserved population to ensure that they have access to care. We focus on comprehensive care. So we have internal medicine, family medicine, we have peds, dermatology, women's health, asthma allergy, we have dental, behavioral health services, case management. We also have a sliding fee discount program that offers significantly discounted rates to our patients so that cost is not a barrier to care. And really, because the patients we serve tend to have little to no options, we have to be here. We have to be open, we have to be staffed. And we have learned how important it is to partner with people who share our mission and share our vision and can help support what we do and who we serve. Next slide, please. So as we know, every entity comes with its challenges. And when I think about our challenges at STEAM CC, I think about access and availability. I'm not sure how many of you know anything about St. Thomas, but it's a small island in the Caribbean. And just like on the mainland, we have a provider shortage. So availability of providers is certainly a barrier to care. The other barrier is just access. Again, an FQHC serving the underserved. And our patients typically cannot afford to go to a private provider. So there's access that's a problem for them from the standpoint of finances. But it's also literally getting to their appointments. Most of our patients do not have cars, so they have to catch a ride or a taxi, safari, dollar ride, that kind of thing to get to the appointments. And for the patients on our sister island of St. John, they can't get in a car. They have to find a way to get to the dock, buy a ticket, get on a ferry, come over to St. Thomas, get another taxi or ferry or something like that, and get to the appointment, and then reverse it to go back. So again, transportation and that access is a challenge for our patients. And then our very infrastructure, very limited specialty services are available on St. Thomas, very limited telehealth services. And then from an IT perspective, internet, phone, very, very challenging. And because we're a small island, just 32 square miles long with, I don't know, 60,000 people. And we say, I don't know, 60,000 people because we have a lot of undocumented. So we're guessing what's reported is 45 to 47. It's probably more like 60 to 65. But because of that, we can't support a lot of the specialty services, right? So while we have primary care, a lot of the specialty services are not available. So another gap in access to care here in the territory. But St. Thomas is beautiful, sunny, lovely place to vacation, by the way. But we are an island. So where we are geographically has some effect on us. I mentioned two already, access and availability. And the other big one is more climate and weather related, and that's hurricanes. We were devastated by two category hurricanes back to back within like 10 days in 2017. People were left without their homes, their businesses, their jobs, the schools. There was no electricity for 3 to 4 months. Grocery stores, phones, internet, all just gone. And we can't just get into the car and drive to another state for help. And when your airport is damaged, you can't just fly out either, right? So obviously this had significant impact on our community. Depression and anxiety kind of skyrocketed. People were without medication, so obviously they got sicker. The hospitals suffered tremendous damage. Doctors' offices were closed. Pharmacies were closed because of damage, no water, no power. But STEAM CC was open. So on that first slide that said, we are the community, we are always there, this is a testament to that. We had no electricity at the center. So we literally set up 6-foot tables outside in the sun so we could take care of patients. Our staff lost their homes too, and we had no power and no running water, but the patients still needed help. So we just had to figure it out, and we just had to be there. And we learned some things from that, particularly about the importance of preparedness of the staff, of the community. We had asthma patients. Suppose you have an attack during the hurricane. You can't plug in your nebulizer because there's no power and you can't have your generator on. So we learned we need to make sure they have battery operated nebulizers because the ambulance can't come for them either. We had elderly patients with no water, no power, people with refrigerated medications. So we had to learn ways to help. So we contracted with a care management team, great partnership, and they've developed registries for us. So now we know who our vulnerable patients are. We know the ones that live alone. We know the ones with refrigerated medications, the ones who may need some support before and after a disaster. So a great partnership with direct benefits for our community. We also realized, again, the importance of preparedness. So we are partnering with Emory University to create a disaster plan, one for the center. And I'm also on the committee that's developing one for the entire territory. Really important partnership because we're developing kind of a system territory-wide for emergency preparedness and response. All inclusive, addressing the entire system. Let's hear everyone's ideas about where the needs are, everyone's ideas about where the gaps are, so that from my perspective, I can say, okay, here at STEAM CC, this is how we prepare each patient, not just clinically, but the whole patient for a disaster. And then more globally, how do we collectively prepare our territory for disasters? And I kind of want to mention it. It's an interesting contrast to me here, and that's COVID. Terrible worldwide. We saw an increase in things like intimate partner violence here, and tragically, we had some loss of life. I think we had 133 deaths related to COVID. But in contrast to our hurricanes, this is an instance where our geographic location, I think, actually proved to be beneficial to us. Our homes and our businesses are bright colors, and you look outside your house and you see this beautiful view, and we could still go to the beach. And I think from an emotional health and well-being perspective, being surrounded by nature and color and fresh air put us in a better space. So while there's definitely kind of a negative impact from a mental health perspective globally from COVID, I tend to think we fared better because of where we are geographically with our close proximity to nature, in contrast to what that very same nature did to us in the hurricanes. And when I look at our community, I also learned from these hurricanes what resilience looks like. Back to you.
Thank you, Dr. Richards. And I think, as you're sharing your experience and what's going on, in the US Virgin Islands, I think a lot of those who are on the call with us today can can understand, as a lot of the challenges around rurality, both domestically and internationally, while they appear differently, they still appear. And so when it comes to public health practice, that's where, when we were thinking about how do we really address the challenges that need to be addressed so that we can really move the needle when it comes to social impact, when it comes to serving populations. And that's what led to the establishment of our vision. And we are looking to really contribute to creating a world where strong public health systems empower communities, promote authenticity, innovation, and collaborative learning so that we're now able to get to sustainability for all people. And our mission in how we are contributing to this is by focusing on the public health workforce and looking to see how we can inspire ethical leadership towards creating a better future for all of these individuals. And what is at the core, both at NTI and at STEAM CC, are our values. And as Dr. Richards was sharing, I'm sure we were able to pick up authenticity, the need to innovate, the need to collaborate, and also sustainability. And so when we were informed about some of the challenges that were going on, and that there was an opportunity to partner to bridge the gaps, you better believe we were among the first to be at the table. And why did we come to the table? As public health practitioners, we know that different systems, organizations, entities play different roles in supporting the public health infrastructure. And very early on, we had the creation of local health departments. And at some point, there was a realization that we needed more support, right? And that's where we started to have increasing establishment of government agencies. And with these two entities, we still found that there was a need, right? And that's where we started to see the rise of NGOs. And from there, as you know, and you can see on the slide, there was still another need, right? Because now countries and communities are learning as they are working with each other. And as countries are learning, they're sharing what they're learning with other countries. And that's where we started to have international organizations that are providing that global perspective. And despite all these entities that have come up over the years to fill the gaps and to support the public health infrastructure, we're still seeing challenges. And we see challenges in resource allocation, access to funding. We have challenges in policy alignment. Sometimes we see that there's a little bit of a difference when it comes to what certain sectors are pushing for versus what the community needs. There's a little bit of a delay at times, and sometimes it's just straight misalignment, right? And that really contributes to the various fragmented initiatives that we see. So everybody is championing and moving forward, doing the best that they can in their own bubbles, which is great. But when we take a population perspective on it, it's very fragmented, right? We're not able to reach everyone. And that's not a sustainable way of operating, right, as an industry. And so at NTI, this is where, in how we partner with organizations, we're looking to see how can we really bridge these gaps? How can we get partnerships into a position where sustainability is within reach? How can we make sure that all these entities that have been created are able to work together? And so that is what led us to creating this project that we're going to share with you that's taking place in the Virgin Islands. And Dr. Richards?
Yeah, thank you. So this is this slide is entitled Reach USVI, and that's actually the name of our project. We were awarded a behavioral health telemedicine grant, which is partially funded by HRSA. It's named Reach because that really is our focus, right? To reach the ones most in need, the most vulnerable, the ones with the least access, and bring them into care in an environment of healing and support. We are going to be creating systems, policies, protocols for both acute and chronic behavioral health needs. And what we're hoping is that we can kind of perfect this, so to speak, and expand to other specialties, coordinate with other facilities and support systems, and become the model of how to truly provide equitable access to behavioral health as well as other specialties so we can meet the needs of our community. So just real quickly, what are we doing? We are basically improving behavioral health outcomes by addressing disparities. And there are many, but we're going to be focusing on access and availability. And because of the challenges I talked about a few minutes ago, we realized we could only do this through partnerships. And I just said the word partnerships, and that is one of my favorite words. Data is definitely my favorite, but partnerships or partners, it's right up there. Favorite words, favorite concepts. Because partnering is so important throughout our entire lives. Our friends are our partners, our study buddies, partners, our teammates on the softball team, partners, husbands, wives, boyfriends, girlfriends, partners. And how we select our partners as we go through life is extremely important. And you'll notice that in every instance, we need to select partners whose vision, whose heart, whose character all align with ours in order for it to work, right? Whether that's on the softball field, at work, or in your personal life. If it doesn't align, it's not a strong partnership. So just a little background about how this particular partnership was formed. Again, I've been here for 14 years. Initially, my role was as a family medicine physician. And when I started in this position in 2023, the center was really in financial crisis, a very bad space, literally concerned about being shut down. Well, we take care of 7,000 or 8,000 people every year. So that was just not happening on my watch. The center is too important to too many people because we are literally their lifeline in a lot of ways. So I'm like, I'm just a doctor. I don't know how to do this executive director thing. So it was unnerving, to be honest. You know, I knew how critical it was for us to remain open, and I knew what a bad space we were in. And the first thing I remember thinking is, oh my goodness, this center needs help. I need help. And that's where the partnering came in. I started calling everybody I could think of. I called people in the federal government, the local government, like the governor's office, the senators, the health policy advisor, because I figured if I ask enough people for help, someone's going to bite and someone is going to help. And they did. And a lot of people wanted to help. So I think the first part of creating a partnership is really just the ability to kind of be okay with it, to be okay with needing help, to be okay with asking for help. It's okay to know your limitations and to be vulnerable, right? No, no, I take that back. It's not okay. It's a sign of strength and character to know your limitations, to put aside your ego and say, I don't know how to do that. Can you please help me? And I think you'd be surprised at how many people are actually willing to help inside your organizations, within your community. And as we learned, even people who live thousands of miles away are willing to help. So, with this particular partnership, and this is important here, when you're given an opportunity, take it. We get so caught up in being overworked and understaffed, and we don't have enough time that we can miss out on really, really great opportunities. So, I told you, I reached out to everybody. I'm calling everybody I can. One of them was the health policy advisor, and she said, well, you know what? Why don't you call the director of health information technology? Maybe they have some grant money that can help you guys. I was like, okay. So I called her and she said, well, actually, we're trying to create this health information exchange right now. We're not getting a lot of buy-in. Can you be the pilot center? And even when things are tough and it seems like there's no time or no staff, my motto is always, look, say yes and figure it out. So I said yes. About a month or so later, she's like, are you going to the big community health center meeting in DC? I said, yes. She says, okay, well, I have a good friend who works at Howard. She runs the PharmD program there. She wants to meet with you to talk about a potential partnership. So of course, at this point, it's like, roll your eyes. I've got stuff to do. I'm going to a conference. I don't have time for this. And then she's like, and then there's another person named Luigi LeBlanc. He's going to be there too. He's from Zane Networks. It's a great company that provides transformation services and solutions to hospitals and healthcare systems. And their goal is all about equitable care. So again, internal eye rolling, and I'm too busy, thoughts are going through my head. And I was like, you know what? She's putting us in here for something, for some reason. I'm just going to say yes. So I said yes. I said I'd say yes and figure it out. So I did. So we had this lunch meeting, and Dr. Mary Awanda is the person she was talking about at Howard University. So Dr. Awanda, Mr. LeBlanc, they're both there at the meeting, and she wants to send PharmD students, residents, down for us to kind of participate in their training as residents. So again, I'm like, I don't have any space. I don't have any staff. I don't have any time. And didn't I just tell you I was in crisis mode? But the rest of me said, you know what, you were a student at one point, and because of that, I never, ever, ever say no to any student ever, because I'm like, somebody said yes to me. I always say yes to students. So once again, I said yes, I'll figure it out. And then after having a conversation with them for a while, I was like, oh my gosh, this lady is awesome. She's so passionate about healthcare in her community. And then she topped it off with, and you guys have a 340B program. You know what? We could help you. We could help you. Our pharmacists that come down there can help you too. And then Mr. LeBlanc, awesome. He's like, hey, you know, there's this behavioral health telemedicine grant. Did you guys apply? I was like, no, I can't. I don't know how to write a grant, and I don't have a grant writer. He's like, oh, don't worry about it. We'll help you. So that lunch thing that I was thinking I didn't have the time for was a huge blessing. I got to know two like great people who care enough about us to say, you know, we're going to extend ourselves because your mission is our mission and we're going to help you. Why? Because our missions aligned, because we asked for help, and because when an opportunity was given to us, we took it. We decided to stop rolling our eyes and to not be too busy and say yes and figure it out. Fast forward, Mr. LeBlanc reaches out to NTI to help perfect the grant. And they graciously accepted, took on the project. Why? Because our mission aligned with theirs, because we asked for help, and because when an opportunity presented itself, we took it. And why did the HIT director hook us up with Dr. Wander and Mr. LeBlanc? Why did Mr. LeBlanc hook us up with NTI? Because in each instance, they felt this would be a good fit. You guys will fit for each other. You'll make good partners because your vision, your mission, your values all align, and it just makes sense. And because of that, we now have a 5-year, $1.75 million grant to help us provide behavioral health services to the community. So you reach out, you partner with those that share your vision, your ethos, you help people. You really help people, not just kind of in theory, but a true direct impact on the lives of other human beings through partnerships. So I want a mic drop for that. Back to you.
Very true. Yeah, and I think as we talk about, grant writing, we're kind of like, okay, you had a couple months, right? You pull it together, you send a couple emails. We did this in 14 days. We wrote this grant in 14 days, and it was made possible because everyone around the table was motivated, was passionate, and I mean, we even had time at the end to review, to make a couple phone calls, to really take it up to the next level. And so when it comes to, how do we become efficient, right? Partnership is a pathway to efficiency. When we talk about how do we advance social impact, how do we address health equity, even as a grant writer, grant writing is a tool, it's a pathway for that. And, as we share our story, Dr. Richards shared that data is a favorite word of ours. And everything that is happening and everything that we are sharing is evidence informed. How? Well, first and foremost, the creation of the sense of urgency, right? We put together a task force, we put together a committee, an army of volunteers. And if we deconstruct everything that we've shared, you start to see the 8-step model for change by Cotter, right? Uh, Dr. Richards' ethos, the culture that she instills in her team, the vulnerability that she brings to the table, the psychological safety that she instills amongst her team creates that generative culture. And we know that organizations that have a generative culture are more resilient, are more agile, and in a position to solve problems. And last but not least, we shared that this is not just an organizational change initiative. This is a territory-wide change, and it requires resources. And when you're navigating, piecing together resources, research also tells us that transformational leadership is the way to go. And so, with all of us working in our authenticity, leveraging our skills, our passion, and bringing it to the table, that's where we really start to do, what is supported as well by science. And that is how we are that much more efficient because we're moving together. And so, what does this look like? Dr. Richards?
So we talked about the deficiencies and the gaps that were identified and set a goal to address them in order to provide this equitable access to care that we keep talking about. And this is our care team. And our care team is one of my favorite words again. It's a partnership, right? So who is on our care team to help us accomplish these goals? So first we see our PCP, the primary care providers. They will see the patient, identify the need for behavioral health services in this case, and make the referrals. You see there, arrows also going to our community health workers and our case managers. So the providers will work very closely with the case managers and the community health workers to ensure that referrals are done and that the patients are not lost to follow-up. Next step, we see the psychiatrist or psychologist, behavioral health provider. They receive the referrals, attend to the patient via telehealth using a video conferencing platform, and report back to the PCP. The psychiatrist will also involve caseworkers and community health workers for any support that's needed. Then you see the pharmacist over there. So if medication is indicated, the pharmacist become a part of that patient's care team. And we are working with the PharmD program at Howard University for medication management and education. Remember the lunch we had with Dr. Iwanda? Well, here it is. She's a part of this team helping to provide the pharmacy component to this project. And really, the single most important part of this slide is the patient, right there, kind of in the center. All roads lead back to the patient. We really want to begin to educate and empower our patients and have them more of a part of their healthcare team. I think this picture is so telling of what we intend to do. The patient's right there, and we need to shift our focus to patient-centered care more than it is right now. Our providers, our counselors, our pharmacy are all critical parts, and they're all contributing and collaborating. But the patient is right there in the center where they should be, really kind of speaking to our overarching goal of patient awareness and patient empowerment.
And if you remember at the beginning, we talked about how we need the different entities and actors that are a part of public health to be a part, right? And so far, we've hit about 3 buckets, but there's still one bucket that we haven't yet shared with you. And that's the international perspective. And the World Health Organization is a leader in knowledge management as it relates to what's working, what are we learning as a global community? How are we putting this into action? How are we crossing borders? And how are we doing what we need to do to support the populations that we serve? And so there is a framework of all the different dimensions that we need to consider, assess, and appreciate when we are talking about health systems changes. And while we have a couple years to implement the project, we plan to be delivering services by fall of 2025. And so we are on a countdown as we speak. And I would like to ask you, Dr. Richards, to share a little bit about what's happening in each of these blocks.
Sure. So we'll start right at the bottom. From a financing perspective, this project is partly funded by HRSA, but is certainly sustainable beyond the duration of the project, given the revenue that will be generated by the patient encounters. I mentioned a little bit ago about the care coordination team that we started partnering with during the hurricane. Well, they also partner with us for our diabetes and hypertension and our behavioral health patients. And each of those encounters also generates revenue. So the more we reach out to patients from a behavioral health standpoint, the more revenue we can generate to support this as well. And then we have the 340B discount program, and that generates quite a bit of revenue as well. And I don't know if you remember, I mentioned Dr. Owanda one more time from Howard, who said that her PharmD residents can help us expand this program. So just another benefit from saying yes to that meeting. Partnerships, I know we talked about partnerships a lot already. I will just say one more time, if you're given an opportunity, take it, say yes, and figure it out. Next one up is health information and workforce. We're going to be doing a lot of educational campaigns to launch our project, social media, in-person trainings, going to other providers' offices so that everyone is aware of what's going on and the importance of behavioral health being integrated into primary care. And as far as workforce, we're already working on 2 providers who are just waiting to get their license at this point. So that much is pretty much taken care of. From a service delivery, we haven't started to see the patients yet, but we continue to meet each week in various different teams, the whole team, the governance team, the technical team, trying to work through this and brainstorm and plan as much as we can so that we're prepared for when we start to see patients. And I will say the team that we have, they're phenomenal, and they're so willing to listen to each other and to pivot as needed, which I think is really essential in any partnership. um, Back to you.
Thank you, thank you. And the way that we are able to contribute to this initiative is by wrapping around the team. What do you need? When do you need it? Is there anything that we can run down for you? And because this is such a large initiative and there are so many moving parts, again, our favorite words, we are the keepers of the data. And so our team is looking at all the different dimensions, looking at the research to make sure that every day that the team is moving forward, we are using evidence-informed methodologies, frameworks, reporting out methods, follow-up that we are learning as we are implementing every day, every meeting. There's an opportunity to learn. We are looking to decrease silos as much as possible and cross-train. And as we are taking a year to learn how to work together, because again, there are frameworks around the life cycle of groups. And we know that there's forming, right? There's norming, there's storming, there's conforming, and you keep going all the way around. And so in being very self-aware and keeping the eye on serving the community, we're able to really be efficient in how we bridge storming to get to norming. And Dr. Richards shared, we're creating policies, we're creating new workflows, we're redesigning tools, we are innovating. And on top of that, we are also taking a year to collaboratively design the evaluation that is going to complement and support this work. And so for those of you that are very familiar with the Hopkins curriculum, log frames, right? Log frames, logic models, indicators, it's everything. Everything that we learn as practitioners, there's a place for it. And so we bring this into the partnership to make sure that when it comes to access, when it comes to coverage, quality, and safety, that it's palpable, right? We're able to monitor, we're able to see how well we're doing. And it's not just about checking the box because we've met the indicator that we reported to the grantor that we wanted to share, but it's, are we doing the absolute maximum and most that we could do in genuinely serving this population to the fullest? And that's where, when we are showing up to the table in our authentic journey, that's how we're able to contribute to improved health outcomes. It's not just a feeling, we can measure it, right? Responsiveness of the health system, social and financial risk protection for the various populations that we discussed. And then on top of that, that we are efficient. We are sharing resources, and that in itself is fundraising, right? it is a way of contributing to moving the needle. And so say yes, because every yes has a value to it. And it has a place in where you're trying to go as a team. All right, so innovation, right? Where does innovation happen? As a field, we talk a lot about the no-do gap, right? The researchers are on one side talking about we need more time, right? And on the other side, the people on the field are saying we don't have time. Matter of fact, we're halfway out the door, right? We don't have time to go through all the different processes, to think about it, to reflect. And at the end of the day, in that gap, there's work to be done, right? And we talk about implementation science, right? But it's getting to the point where as a as a global society, what used to work is no longer working, right? We used to have some stability through grants. We used to have some stability, right, through political commitments. We used to have some stability within communities. We used to have something used to be there, and it's no longer there, right? And so what do? Do we stay in crisis? Do we keep panicking? Do we retreat? Some people, do we move out, right? Do we go to another country? Do we give up? And I believe I speak for the whole team when I say we don't give up, we double down, right? And when we're doubling down as practitioners, it doesn't mean that we're not taking evidence-informed approaches. It doesn't mean that we're going to skip steps in the research so that we can move faster, right? But what it does mean is that we are all committed to innovating within the resources and environment and space and sphere of influence that we have. And that's how we bridge that no-do gap, right? That's how you move mountains. And I know you have to be tired of this needle that I keep talking about, but that's how that gets done, right? We've talked about strategic partnerships. It's a pathway to innovation, right? But the real cross-cutting thing that we're talking about is social entrepreneurship. And social entrepreneurship is not just when you have a venture, an organization, a project, an initiative, but it's a way of thinking, right? And as practitioners, sometimes we talk about systems thinking, right? And in social entrepreneurship, the element that gets added onto systems thinking is the economics that supports it, right? What is your financial strategy that is going to make this work? What is your ability to look at the data, to listen to your community, because that's another source of data, to look at the market, right? We spend so much time keeping our head down because we have to make sure that these indicators on this log frame are connected. We have to make sure that we have a sound and rigorous design. And yes, yes to all of that. But we have to look up and see, how is the market moving? What matters right now? How do we communicate, not just in a way that we understand as an industry, but that others understand, because that in itself is a form of empowerment, right? I understand what you were saying. I understand what you were trying to do. And I can now think about how I can innovate within my sphere of influence to contribute to where we're going, right? And this is something that happens together, right? We cannot just generate and collect data on our own. And so I will pause here. Dr. Richards, any thoughts, perspectives, things that you're seeing on your side in the industry?
First of all, not a lot, because you just said it all and everything. I'm going, Um, but you said two things in particular that really struck, and the main thing was listen to your community. because I think sometimes we're kind of looking at our books, or we're talking amongst ourselves, and we come up with exactly what everybody needs. And it's not necessarily what the community is really needing. And we have data, and it's in these little silos everywhere, and we're not coming together to truly affect change with good data, with responses from our community, with us listening to each other to kind of affect change. But no, outside of that, like I said, I think you got it spot on. Got it spot on.
Yeah. And, you know, the other thing that I would add to this is leadership. Leadership in the sense that when you are looking at the different pieces that are in front of you, there are constraints that are very real, right? There are parameters that you have to abide by. There are policies, there are procedures, and sometimes it can feel like, you know, it's not possible to innovate. And you can still innovate because some of the best innovations are intentional, evidence-informed, community-supported tweaks to what exists, right? And that's where the elevation comes from. And as a leader, when you are able to see the big picture, that's where you really need to think about how do we bring in both and thinking instead of either or, right? Either or thinking is, you know, either we do it the way that we've always done it or we're not doing anything at all. Both and is, okay, there's the way that we've done it traditionally, there are reasons why, but there's also an opportunity. Where can we find that middle ground so that we can pull the best of both worlds? Does that mean that initiatives are going to be fully formed? No. But does that mean that it's a step forward? Yes, right? And we want to be moving forward because insanity is doing the same thing over and over and over again and expecting different results. And so as we think about leadership, it's not always with a title. You can lead from any position. You can lead in thought. You can lead in passion. You can lead in energy. The opportunities are endless. And so on innovation, I'll leave it here. And we had, I would say we had a lot of fun thinking about what some of the key takeaways are going to be for the next generation of public health practitioners. The landscape is changing. The political climate is changing. The needs of populations are changing. And we still need to show up, right? We're not giving up. And so when we are showing up, there are two parts to this. The first part is you yourself as a practitioner. As individuals, we need to take care of ourselves. We are so ready to show up for others. We are servant leaders, right? Don't worry about it. I will sleep when I'm done. I will take a break when I'm done. Or I can't afford to take a break because somebody else somewhere is not getting a break. And that's true, right? But you have to take care of yourself, or you will not be in a position where you can help others. So first and foremost, please take care of yourselves, support each other, create space to energize and empower each other. The second point, invest in your academic growth. There are hard skills and there are soft skills. But as both of us shared our experiences, there are hard skills that very much support what we are doing and how we do it. And it also helps us to be able to ask the questions that we ask, right? It opens our perspective. It introduces elements that we never would have come across if we did not put ourselves in spaces where we could grow and learn from others. And that can take different forms. And so back to authenticity, what does that look like for you? Is that learning from a coworker? Is that learning from a professor? Is that joining a degree program? I'm a little bit biased. I love this program. But, you know, is it joining a degree program? And what is that right program for you? But you can learn every day, right? It's not only when you're in school, but when we talk about agility, you are learning every minute. And next, seek out mentors, because we can't survive on our own. As human beings, we thrive together, whether you are introverted, whether you are extroverted, whether you like it or not, everything happens for a reason. Do I feel like going to a networking event right now? Probably not, right? You're thinking about, I need to rest so that I can get through, you know, the next few rounds of papers. I need to rest. I'm not really getting through my analysis, or I need to rest because this is a mess. Okay, and I really don't have time for this. But you really need to seek out mentorship. And that is where that vulnerability that Dr. Richards was talking about comes in, right? Because you are being intellectually humble and saying, I don't know everything. I'm open to only having one slice of the pie, one fact, one piece of the puzzle. And I am in an environment where somebody is also investing in me. Somebody is saying yes to me, right? And we can all say yes to somebody. And so seek out mentorship. It's crucial. It's crucial. And immerse yourself in the field. Please leave the library. You will be okay, right? Leave the office, leave the building, and spend time in the community. Walk side by the populations that you are serving. Ask questions, observe, genuinely immerse yourself in the field. And that can take different forms, from volunteering to taking on internships, to taking on fellowships, to just asking for informal coaching from somebody that you admire and appreciate, right? But always be looking for opportunities to immerse yourself. If you're not immersing yourself and you're always comfortable, that's where you're not really creating that space, because in that space, that's where you have the opportunity to grow. And in order to grow, you have to take risks. You have to fail forward. I'm not saying to just fail and sit. No, fail, but fail forward, right? That's where you're able to learn. Everything is a data point. I tried this, it did not work, right? And we talked about both and leadership. So figure out, you know, maybe we shouldn't use a $2 million budget in its entirety, right? But how can we take safe risks and create an environment where we're able to learn quickly, we're able to fail forward? And so take care of yourselves, because it starts with you.
I think she was talking directly to me there when she's like, you have to get rest. You need to you need to get some sleep. So thank you. So collaboration, we are people first, and we talked already about how important partnerships are, like I said, from preschool on. Um, and the more we are willing to collaborate with others, the further we get, the more we can stretch our resources, the more we learn from other people. When we were talking about individuals over here, this is all about learning and growth and expansion. And we do the same thing with partnerships and collaborations. So that's one. To appreciate the role of history. And this kind of goes with number 4, when you're seeking out intergenerational collaborations to some degree. Because one, appreciate the role of history. You learn from what's already happened in order to figure out where to go from here. In this particular role that I have right now, I had to go back and look at mistakes that other people made, look at mistakes that I've made, in order to say, how do we not do this again? How do we make this a better center for the community? But also, when we talk about the intergenerational collaborations, when you look just in a family, when you have that strong intergenerational bond, that makes a much more healthy family dynamic. It does the same thing in your workspace, in your academic space, because you are learning from people who have history and who have experience. So even if you don't use the same technology and methodologies, they still have something to give you because they've lived through it. They have experienced it. Whether you take what they're teaching you and say, yes, I'm going to do this same thing, or take it and say, okay, this was a bad way. Let's pivot a little bit. Let's tweak a little bit. Let's PDSA this, and change around a little bit and see how we can make this better. You said immerse yourself in the field. I think that was one of the most important things that you said. Immerse yourself in community and move together. You absolutely have to do that. Um, we had a huge center here, but the ED's office was kind of separated all by itself up with these hardwood floors, et cetera, et cetera. One of the first things I did was we need to give up that space because they need to see me every single day. We were going through a crisis. You can't have the separation. You need to be right in there. That's the only way I was able to learn what was really going on in the center, what the staff needed, what the patients needed, where we were doing things right, where we were doing things wrong, where were the areas for opportunity for growth, was because you have to immerse yourself in what you're doing. So for me, it was immersing myself in the center. And for you, it's in your community and in your field, learning from other people. And you can learn from absolutely anyone. Please don't ever think that whatever letters you have after your name mean that you can't learn from somebody else, because I have learned from every single person in the center, regardless of my title. Seek out intergenerational collaborations, we kind of mentioned already, but walk in your purpose. Same thing we just talked about. You have to be really committed to what you're doing to affect change in this arena. This is not about titles. This is not about educational levels. This is not about training. This is about who you are as a person. Do you actually care? And if you do, and you walk in your purpose, you will move mountains.
Absolutely.
Yeah.
Absolutely. And I would just add that, the title of our presentation is, it has strategic partnerships. And something that we've learned as a team is that strategy is not a document, right? It's not a piece of paper. It's not, I know we love our reports in public health, right? Very nice report, infographics, everything, strategic plan. Here's where we're going. That's one part of it, right? The vision. But the tips and the takeaways and the framework and the examples and everything that we are trying to communicate with the community at this point in time are ways in which you can learn from what we've done, from what we've learned, and use what makes sense and is authentic to your journey to make your plan. And that might not be something that, you can communicate. It might not be something that you fully understand. And it might feel overwhelming, right? Because I have this big dream, this big vision, this thing that is bigger than life. Where do I start? And it's okay to only have one slice of the pie, one piece of the puzzle today. And as long as you are making the best decision that you can with all the information that's in front of you today, that's the right answer. Tomorrow, it will be a different situation, different landscape, different data points. And in public health, we look at all the data, right? And so let's stay agile, let's stay empowered, let's stay fired up, let's stay connected to our communities, let's take care of ourselves, and let's keep innovating, let's keep thinking, and let's stay committed to education, to training, and to community. And so with that, that concludes our presentation for today. And the way that you see us presenting today is how we show up every day. It's who we are. And so please don't hesitate to reach out to us. We are always available. And as we said, we're committed to making a difference. We're committed to partnering, and we're committed to investing in the next generation. and facilitating those linkages with previous generations. And so with that, I will yield the rest of our time. Thank you.
Say yes and figure it out, everybody. That's all I have to say. That's my main takeaway. Say yes and figure it out. Thank you guys so much for inviting me today. I so appreciate you.
Wow, that was such a great presentation. Thank you so much, Halima and Dr. Richards. I know we are close to our 1 hour mark, but I'm not sure if you guys wanted to stay on for a little bit and maybe answer a couple of questions that we have. Um, if anyone does have any questions, feel free to put them in the Q&A section and we can kind of check them out. I know, again, we're running a little bit close to our 1 hour mark, but that was such a great presentation. So thank you both again.
Thank you. And we're available to take questions. Yes. But you know, Morgan, I think they really heard Dr. Richards. So everybody on the call is saying yes.
I was just going to tell you, it's because you were so thorough. They're like, I
Yeah.
don't have any more questions. I know what I'm going to do. They're getting off of this right now and going into the community. They're going to go immerse themselves right now into whatever
Yeah.
they need to do.
Exactly. I feel so inspired after after that session. So thank
And
you
I do say
guys.
yes to all students. So if you guys want to get out of the cold weather and come do a little something in St. Thomas, you need to let us know because I say yes to every student.
Oh, I love St. Thomas. My in-laws are from St. Thomas.
Oh,
So my
really?
mother-in-law is like there every other month or so now that she's retired. So
Well,
my
my
favorite
place, so I must
beaches.
know him. So, oh,
Everyone knows each other in St. Thomas.
exactly. Yeah, yeah, yeah.
Okay, we have a couple comments and questions, so maybe I can read it out.
Absolutely.
So we have a comment from Marianne Smith. She says, "Thank you so much." Lots of exclamation marks. Excellent presentation. Thank you. We have a comment from Robin Tripp, and she says, "Hello, great presentation. This is more of a comment and invitation. Robin is the Director of Education for Revenue Cycle and Coding at the American Health Information Management Association. And she says, please let me know if there are any collaboration opportunities regarding social determinants of health and ICD-10, CM codes. She would love to collaborate and assist in any way possible with your projects. That's projects with an S and a smiley face.
So she knows that we're just going and going and going. Well, thank you so much for that. If you'll put an email, well, my email address is there. So if you can send me your email address and we can kind of have a conversation. Thank you. I appreciate that.
Yes. And we have a comment from, oh, I do not want to butcher your name. It's a beautiful name. Last name Jamali. And they're saying, thank you for the great presentation. Is the recording for this presentation available? And if yes, where can we get it?
Yeah, so the recording for the presentation will be, I'm sorry for jumping in, available within about 24 hours, probably by the end of the day. It will be on our YouTube page, but I will email it out to everyone who registered for the event as well.
Awesome. Thank you. We have a comment from Lawrence Sneakway. He says, great presentation. Thank you very much to Mrs. Ouedraogo and Dr. Richards. So you're most welcome. We have a comment from Dr. William Brieger, and he says, in these days of uncertainty, your positive attitude is inspiring. Robin is responsive and agile. Robin has extended her email, and so we'll
Yeah,
take note.
thank you. Thank you very much.
And we have a comment from Kimberly Fish, and she says, I got married in St. Thomas. Thank you so much for the great presentation, and with love from Minnesota.
Oh, thank you. You have to come back. Do like a 15 year anniversary or something there.
Yes, yes. Okay. Ooh, we have a message from Dr. Hagiratu Ouedraogo in French. And so, okay, so she's asking, is it possible for the information that has been presented to be put in different platforms? Is it something that can be disseminated? And I will let you guys respond to that while I recall the rest of my French to read the rest of the question. Yes.
Yeah, the presentation again, it's going to be recorded. It's going to be emailed out. I'm not sure if you wanted me to attach your slides or anything to the email as well, because I can most certainly do that also.
Okay, and she's asking, is the work that we are doing also something that can be implemented in other countries, in other regions, when it comes to international development? So maybe I can take a stab at it. I think as we're learning from the work that we're doing in the US Virgin Islands, you know, we're learning about rurality, we're learning about infrastructure, we're learning about how to connect systems. And I think those lessons are things that we can definitely extend to partners coming from, you know, different countries to say, you know, here are our data points, you know, what are you seeing and how do we partner towards that? And so absolutely, there are elements that can definitely be extended into the development and international sector. And finally, in her comment, she says, congratulations for the presentation. Great.
If I can add something to that, I think that, some of the challenges that we face because of where we're located and because of our culture and our community and stuff, it may actually be very beneficial to some of the international countries. So I think I agree with you completely. I think we can take some of that and you can learn some stuff from us, partnering, collaborating, guiding you where we went wrong. So absolutely, anytime you wanted to have a conversation about that, I'm happy to talk to anybody. Absolutely. Except I can't do it in French. Yeah, I need your help, please.
I was going to say, I have to sharpen up. We'll be ready. We'll be ready.
All right.
Yes.
I did see someone had their hand raised. If you want to raise your hand again, okay, I can allow you to speak to answer your question.
Hi, good morning. Really wonderful presentation. I was wondering where else you might be speaking. Do you have any other speaking engagements coming up, or where we might be able to really follow the progress of not just this work, but kind of both of your careers?
Oh,
Yeah.
oh, I don't have any speaking. I don't ever do this, actually. This was so no, I don't have any sort of speaking things. Like I said, this is something I've ever done before. Um, so I don't know if Miss Ouedraogo has anything, but I don't have anything coming up.
Absolutely. So I can say for NTI, we are really committed to training the next generation of social entrepreneurial thinkers. And so on our website and as well on our LinkedIn and social media, we are disseminating little tidbits as we are looking at the changing environment, as we are working and consulting for different organizations, different public health leaders, hearing from various generations. We are trying to push out as much as we can to really empower everybody that is on the ground, that is in the office, whoever you are, so that we can really keep moving the needle. We will be doing live courses. And so our first course is actually to support nonprofits and how to lead through crisis. And we've really been studying the changing landscapes, the dynamics from a business development perspective, looking to see how do we deconstruct strategic planning and the core elements in resource mobilization so that anyone anywhere that takes the course is getting something that's evidence supported and that will yield returns. And we are partnering with George Washington University as well to support their new venture competition. And so we will be coaching, mentoring, and facilitating workshops for their social intervention or innovation track. And we will continue to extend information. And Dr. Richards doesn't know it yet, but we are going to keep the community informed in the work that we're doing because it's really an honor to be able to walk alongside the community. And as we learn, you better, but better believe that we're going to spin it so that everybody is learning together. And Morgan, do we have time for maybe one more comment?
Wonderful. Thank you so much. I look forward to getting on your website and looking through some of the courses that you're offering, and of course, continuing to learn about the project. Thank you.
You're most welcome. Thank you, Dr. Sargo. Okay, and I believe our closing comment is coming from Dr. Kulbali. And he says, "Thank you for the great presentation. My name is Isaka Valentin Kulbali, and he is a public health specialist working on SWEDD program in UNFPA in West and Central Africa, funded by the World Bank. And one of their major project components is the last mile delivery of reproductive health and family planning commodities, including the use of drones. And so they would be really interested in how we might be able to collaborate to reach communities that are hard to reach." So Dr. Kulbali, I believe we will be in touch to explore, what that might be able to look like and how we can learn from each other. That's amazing. That's innovative, right? That's pioneering.
Definitely innovation right there. That's awesome.
Yes.
Okay, so I guess we can wrap it up now as we are a little bit over our time, but no worries at all because we had really great conversation to top off a really great presentation. So thank you so much again, Halima and Dr. Richards. It was such a lovely presentation. Everyone, I'm sure, is inspired after hearing you guys. As I mentioned, I will follow up with everyone on the call. I will send out the link to the recording of this presentation. And I can also include our presenters' information because it seems like a lot of people want to get in contact with you guys.
Thank you all so much for listening to our story. Thank you, team, for your support. And we look forward to hearing more about what's going on with you all and what's going on in Africa. And we will keep you all posted about STEAM CC and our successes. Or, of course, you could just come and take a look. We'd be happy to have you with us.
She's not kidding. We're going in April. So, hey, check your calendars. And thanks in advance to everybody for saying yes, for continuing to do what you do, and for just being an example and continuing to partner because that's where change is made. And so we look forward to crossing paths on the field, online, and to being a thought partner as we solve, the public health challenges that we're navigating.
Okay, have a great day, everyone.
You all have a great day, everybody. Stay safe.